Hi, my name is Kasey Frey. I am a senior healthcare administration major studying a pre-physical therapy track at Arcadia University.
Hi, I'm Amy McDonald. I'm a sophomore, healthcare administration major, pre-physical therapy as well at Arcadia. What do college students focus the most regarding their healthcare?
So for this question, I spoke with a lot of my friends, my fellow classmates, my peers, and a lot of college students our age, their main answer was quality. They were really focused on the quality of their care. Many of them also said location and convenience. Being a college student, you're likely to go to the doctor wherever it's most convenient for you, or even urgent care centers. So that was a big answer as well. One of my friends who has a chronic condition did say that he focused most on his ability to understand his doctor, his relationship with his doctor, if he can understand what the doctor is explaining to him about his condition. Not surprisingly, most students were not really focused about care, and personally I think that's because kids our age are still on our parents' health insurance, so cost doesn't really affect us financially. We don't really see the costs a lot of times, so I would say most college students are really focusing on the quality and probably the convenience of their care.
I was thinking with this question that it was more like what aspects of healthcare do they focus on? So I was thinking more like the mental health aspect rather than like short-term care or even long-term care if they were to need it, because I guess that's something that kids our age don't really think like, oh, I'm going to be going to the emergency room a lot, so they don't really have to think about insurance in that way. So it's more mental health, and plus on college campuses that is pushed a lot is like mental health, taking care of your mental health, and there's a bunch of resources here, so I feel as though that's mostly what people focus on.
Definitely, and I think mental health is an area of healthcare that this country is lacking on. Maybe not lacking, but could be equally as strong as the rest of our healthcare with primary physicians.
Yeah, and I think that's the only part of healthcare that is discussed with college students, for being honest. Okay, so as a healthcare administration major, what do you see as the greatest challenges right now with our current healthcare system?
This is a tough question. I would say, I think overall just the complexity of the healthcare system in the United States. I think it's hard for even students like ourselves who study it day in and day out to truly understand the system. So regular average citizens are going to have even more of a hard time understanding the system and navigating the system, and the inequalities that the complexity of the system creates, and just our nation's access to healthcare. There's so many challenges. We could go on for a long time.
I was definitely thinking it's definitely people our age trying to understand what they do have access to through their insurance. If I didn't take the classes that I have to take for my major, I would not have understood insurance at all, and I think there's some parts of insurance that even my parents don't understand that I was trying to explain to them, so it's kind of like, how are people our age supposed to understand? So yeah, I think that's definitely one of the biggest.
And I think especially with all the policy changes that are rolling out, there's changes happening almost every day. So not only understanding the system, but then on top of that, trying to stay up to date on the changes that are happening makes it even more difficult.
Yeah, and I think a big thing is that kids our age think it's not going to affect us, so we just don't keep up with it, but in reality, we are the next generation that has to follow this in order to, know what rights we have and, what we can take advantage of.
Yeah.
All right, so as a future clinician or administrator, how do you think you or your generation of professionals can ensure that the rights of patients are honored?
So I think this is a really good question from our perspective, being that hopefully we are future healthcare providers, hopefully physical therapists. Personally, I think first and foremost, the first step is to inform patients that they have rights, because a lot of patients aren't even aware of the Patient Bill of Rights. They don't know that it's out there. So as a provider, I think my first step would be to inform the patient that they have rights, encourage the patient to research their rights so they can be informed consumers of healthcare, and then really just making an effort as a provider to ask questions to make sure that the patient understands their diagnosis, and really creating relationships with your patients that are deeper than the surface level to show that as a provider you're truly engaged in your patient's healthcare. And then of course making sure that their privacy is kept. And as providers we can be conscious of this for ourselves, but also with our coworkers. If you see a coworker who's maybe not working their hardest to keep a patient's privacy, it's important to remind them of the patient's rights.
Yeah, I was thinking kind of as a physical therapist, you know, you're with people in their time of need, and so kind of trying to explain things to people in ways that they can understand. I mean, you could use the big terms, but also then kind of break it down for them and tell them, you know, you can either go about it this way or this way, you know, just trying to be like a support or a help, you know, because they have so much other things to worry about that you can definitely offer your knowledge.
I think that's my biggest thing too, is how you were saying, explain things to the patient in a way that they can understand, and then following that, ask questions to the patient to make sure that the answers they give you are correct and they're truly understanding.
Yeah, definitely. And definitely build that relationship so they do feel comfortable asking questions.
Yeah, you're right.
All right, so do you feel that college students are concerned about changes in the healthcare system?
So I think we actually kind of touched on this one a little bit already. I would say no. Definitely college students are not as concerned as they should be with changes in the healthcare system. Like you had said, these policy changes that are happening, they take years to implement. So by the time we are in the workforce and we're receiving employer-sponsored insurance, these are the changes that are going to be directly impacting us and our healthcare, not necessarily the minute they roll out, the people that are in the working world now and consuming healthcare on their own. So I think it is important that we as college students stay up to date on these changes, follow them, and really make an effort to inform ourselves and understand these changes.
Yeah, I was thinking that college students are not very concerned. I'd hate to say it, and it sounds terrible, but yeah, they aren't. They're only concerned about the things that will affect them most. If you notice, even on social media, the kids only talk about things that will affect them. So, yeah, a lot of kids haven't been touched by chronic illnesses, and so they can't relate, and they feel as though it's not something they need to educate themselves on. And plus, today, there's a lot of political things going on, so they feel as though it's not as important because it's not affecting them. So, I mean, they focus on just really mental health, and I would like to say probably like birth control, but that's it. That's definitely it. So, no.